You have a vaccine mandate. It has gone well. You've had to terminate just a couple of employees. Any is a lot. I understand that. But overall, you're performing as one of, if not the best hospitals in America after a lot of initial hesitancy, which we talked about on this show. How have you done it?
Well, thank you so much for having me. I think the approach we've taken is one of compassion and understanding for folks who are initially hesitant. But after a few conversations with trusted individuals, myself and others who are trusted in the organization, folks ended up deciding to do it. I had personally had lunches with folks across the organization who are unvaccinated, had a lot of good questions about side effects and other rumors they had heard. Misinformation, of course, is a problem even for healthcare workers. But if the stakeholders across the table are trusted folks and there's buy-in from employees on what leadership's intentions are when it comes to protecting the workforce, it can work. And so we have over 93% of our employees now vaccinated with the mandate. And we just added the Johnson & Johnson booster as a part of our mandate for folks who receive that as an initial course of vaccination, given the FDA's decision-making and the CDC's decision-making last week. And so far, there doesn't seem to be much pushback. We just announced it yesterday. But I think this is an important step to protect the 270 or so employees we have who had that vaccine.
Yeah. And for people that received the J&J vaccine, have you seen more interest in them moving over, getting the half dose of Moderna or whatever it is, and that booster shot? Are we seeing kind of people being more selective, doctor, about the vaccine they receive, either initial dose or booster?
I was just rounding yesterday throughout my hospital to get folks' perspective on this. The folks who receive J&J are actually eager to get a booster, and they're eager in many cases to get a different shot. And so I think the FDA's decision on allowing mixing and matching is one that I think a lot of folks will appreciate because of what they've heard according to the data on the effectiveness of that. And so you may see that more in J&J recipients because of that decision to basically say that one shot may not be enough anymore in the context of the Delta variant. We've seen that with our employee discussions thus far.
And what are you seeing from hospital levels overall? Obviously, doctor, the weather has been helpful. I know people hate to talk about seasonality. We've talked about this before, but it does seem to certainly play a role when people go inside or outside. It's getting cold. It's rainy. Are you guys expecting a kind of a last surge, a late fall, winter surge here among the unvaccinated? What's your preparation right now for the next few months?
We are expecting that with folks moving more indoors, with folks gathering for the holidays. There's an expectation that in the context of the Delta variant especially, we will start to see an increase in cases. And so we've had about only 10 patients with COVID-19 in our hospital for the past several weeks. The beginning of the school season did not lead to an increase in cases in our area, thankfully, and significantly. And so what we're really worried about, though, is, again, folks gathering more and more indoors. And we're trying to get everybody to get vaccinated as much as possible in the community to prevent, hopefully, what we don't want to see, which is another surge in the winter.
Well, yeah, because if you go on this thing called Twitter, doctor, which I know I'm kidding, we're all familiar with it, it's all doom and gloom. You look at the so-called experts, everything is doomed. You have not seen that so far with kids, correct? School's been in for 3 weeks to a month, depending on where you are. And we are not seeing this huge influx of kids with COVID, thank God, coming into your hospital, at least not yet.
Well, it helps in New Jersey that we have a universal mask mandate in schools. I want to make sure that I caveat my answer with this. Not every state has that. In fact, many states have outlawed such things. And I think that's a bad thing for public health. We have seen an increase in school outbreaks, but not to a point where you see in other states. And certainly in our hospital, while we've seen more pediatric emergency room visits, we have not seen a surge in pediatric patients in our ICUs or even in our regular medical surgical beds. And so I know that not every region in the country can say that, but I think in large part because we have that mask mandate in schools, we've been protected so far. And of course, we're waiting as soon as possible for the ultimate decision making from the FDA on Pfizer for kids. We do hope that goes through to protect our kids.